who is the president and CEO of the AECF Foundation, a private philanthropy dedicated to building a brighter future for children, families, and communities in the United States. Patrick has a PhD in social policy from the Bryn Mawr College Graduate School of Social Work and Social Research and an honorary degree of laws from Montclair State University. Throughout his career, he has focused on reforming public systems that serve families facing significant barriers, closing youth prisons, and creating economically inclusive, family-supported communities. And so I will do my best to follow along since I'm in charge of the slides. And I can't see you.
Thank you, Denny,
Okay.
and good afternoon, everybody. Do I have to push this? Yes, I do. Good afternoon, everybody. Earlier in my career, I was the director of a state government division that was responsible for all of the child and youth prevention programs in the entire state. And we had a budget of several $1 million, and I had to make decisions about how we would invest that money. I have to tell you, this was an evidence-free zone. We did very little to even determine who was using these programs, much less whether they worked in any way or made any difference at all. And it was from that experience that I became more and more convinced that the focus on evidence that we're talking about today is critical. When I joined the Casey Foundation, I brought that perspective with me. And as Denny said, it's a foundation that's dedicated to building a brighter future for all of America's children, with a special attention to those children who come from families that face lots of obstacles and challenges to helping their kids do well. Much of what we do is to try to bring evidence, research, data to decision makers, such as I had been in that previous job. We focus a lot on large public systems like child welfare and juvenile justice and mental health and workforce development, education, etc., and on whole communities. So that's kind of what we focus on. I'm going to be talking mostly this afternoon about our work to build evidence-based prevention programs and give you a number of examples. But before I do, I feel it's important to underscore what I think most folks in this room already realize. The root causes of a lot of the problems that these programs are meant to address lie in three core problems. Poverty. If we didn't have so many poor kids, we would not have the kinds of bad outcomes that we see. Racism, the day-to-day experience of discrimination, or the microaggressions, or the stress and trauma that goes with this country's not only long history of racism, but also a lot of the racism that we still experience today. And very, very bad policy decisions by government. For example, deciding to unnecessarily remove children from their families. So I will be talking about programmatic interventions, but the foundation also invests in research and evaluation that tries to help with those kinds of larger systemic issues. So I'm going to talk briefly about the kinds of things that when I was running this division I wish I knew more about. And that is data on child and family well-being, research and evaluation about what works, how to develop and then implement promising programs, and then I'm going to give you a sense of an attempt we are in the midst of to take some of these ideas to scale in several communities. But clearly, we can't begin to address problems unless we know what those problems are and which children and young people are most touched by them. The data tell us where to look, they tell us where to focus our energies, and hopefully they tell us whether or not things are working. So for the last 30 years, the Foundation has published Kids Count, which is a national summary of the well-being of kids and families. We also have in every state a Kids Count organization that does the same thing for their state level. In that work, we pull the data apart. We try to see which kids are having more problems than other kids. We recently just put out our second Race for Results Kids Count report, which basically disaggregates all of the data that we have available to us and compares states for how different kids from different racial and ethnic groups are doing in the most important outcomes that affect their long-term success. In addition to the data that we collect and present ourselves, however, we recognize that public systems themselves hold huge amounts of data. Let me tell you an example of why figuring out how to use that data is so important. We're working with a jurisdiction right now, it's a very poor city, and we are helping to fund a workforce development program that will build a pipeline from graduates of the public high school into a family supporting career with a career certificate. These are for young people who are choosing not to go to college and who otherwise become disconnected from economic opportunity. So we're funding, we and some others are funding a 500 slot demonstration of this, a test if you will. And we discovered that the providers had a standard, and the standard was that you had to be reading at an 8th grade level. The school system informed us that they couldn't come up with 500 young people who had graduated high school who were reading at an 8th grade level. This is a school system that graduates roughly 4,500 young people. So if we're going to make sense of this horrifying statistic, we can't just look at the education system. Data on these young people are sitting in our child welfare databases, health, early education, financial assistance, etc. We've got to figure out how we pull this data together and really unpack how we have these young people in this horrible situation. So in addition to the work we do on data, we also invest in developing programs that hopefully will show evidence that they can be successful, and figuring out how do you implement programs that have already demonstrated effectiveness in some other jurisdiction. And what we're finding is that we have a particular niche in identifying promising programs that need some additional support in order to become truly evidence-based. And we often find that those are the programs being developed within communities, often by people of color, who do not usually have the resources to do the kind of evaluations that get them on the path towards a fully evidence-based intervention. In addition, we are working increasingly on how do you get large public systems to adopt and adapt evidence-based interventions so you can get to some kind of scale. What we found is usually a public system may fund on a relatively small scale an evidence-based intervention, but the rest of the system doesn't change at all. And the reality is that a bad system will trump a good program every single day of the week. And so the program doesn't work. So we're going at it in a different way. We're starting with the systems, and we're trying to bring the developers into working with the systems to develop interventions that actually fit with the systems, even as we try to help the systems change the way they usually do business, so there are more, it's an environment in which that intervention can work. And you see in this slide some of what we've been doing. We're working in 42 different programs in 35 public systems around the country. 700 staff have been trained so far. About 15,000 children have been touched by these programs. Still early days of this work, but we think that's part of the path toward scale. I also want to make sure that I'm not running out of time. Good. I also now want to turn to an initiative that we started a few years ago that tries to bring all these different strands together. We call it Evidence to Success. And we recognize that there's usually this disconnect. I know I was in this position, this disconnect between the public systems and the communities with whom they're supposed to be working. So we tried to figure out how do you bring this together, especially around something as wonky as evidence-based interventions. Like how do you make it so folks aren't just talking past each other. So we developed these elements, this framework for evidence to success. And what we essentially do is, next slide, what we essentially do is work with the community to do a youth experience survey. Now, it's not a typical survey where we ask their opinions about things. It's actually a collection of different symptom checklist kinds of things. So we end up getting a picture, not about individual kids, but about all the kids in that community. Like, what are their experiences? How many of them are suffering from trauma or depression or anxiety or have absenteeism or a physical health problem? And because it's a saturation approach, we try to have every single young person and child in that neighborhood touched by this survey. We end up with a very full picture that we can then work with the community to say, here's what we see. This is how kids in your neighborhood are doing compared to kids in other neighborhoods. What do you want to work on? What's most important to you? Because now they have data. And we bring the public systems to the table to be part of that conversation. So the public systems, education, child welfare, juvenile justice, etc., together with the communities, make a choice on which issues they want to address. And then once they do that, we turn to the Blueprints website, which has a collection of evidence-based interventions arrayed by the kinds of problems they meant to deal with, and say, you know, of these 3 or 4 programs that seem relevant to this problem, what's good for your community? What's going to fit? What feels right for you? And so the community and the public systems then choose the programs. We help them figure out how to pay for all this by doing a fund mapping and figuring out how they start to shift financing. So we started in Providence. It was the prototype, made lots of mistakes. Providence was resilient enough and imaginative enough to be very successful in doing this. And we learned a lot from them, and now we've expanded to Selma and Mobile, Alabama, to Kearns County in Utah, which is Salt Lake City, Memphis, Tennessee, and Miami, Florida, those last 2 being the most recent. What we're seeing is, in the case of Providence, some early success, too soon to claim victory, some early success with a marked reduction in absenteeism, which is one of the things the community chose, and a very marked reduction, by half, in school suspensions for elementary school and middle school, which we all know begins to predict for problems in high school. Again, too early to claim victory, but they are now up to 5 evidence-based programs that the community and the public systems jointly have chosen and are now implementing in these neighborhoods in Providence. The other neighborhoods, again, are in the early stages of doing the youth experience studies. We're finding, and this is one of the tests, we're finding that money is starting to move. And as anybody who's ever worked in a state or city or federal government for that matter knows, that's not the same as a child outcome, but if you can get money to move, you're starting yourself down a path that really can make a real difference. And so that's the work in evidence to success. So let me just close with some of the lessons that we feel like we've learned, and I'll be very quick because I have 1 minute. I want to put in my clock, but that's okay. 1 minute. Partnerships are absolutely critical. Partnerships between universities and communities, for example, between government and communities. It's all about relationships, so that's absolutely critical. Culture is critical, so you need to find folks within community who are willing to work with you and both help you understand what's really going on in that community and help be an ambassador on your behalf to the community so you can work together, so you understand what the culture is about. Evidence comes in lots and lots of forms. Yes, quantitative data is essential, RCTs are essential, but we need to know the story behind the data. So rigorous qualitative evidence is important. We know that research also has to be conducted in a way that respects community values, that engages communities. So many of these communities, the residents will tell you within the first 5 minutes they've been researched to death and nothing ever changes. And they become objects of research rather than full participants and leaders in research. It's a shift in paradigm that I think is really critical. And I'll end with just what we're learning about what we at least think federal government can have a role in. I mentioned integrated data systems. The federal government has a big role to play in how regulations are written around privacy that enables at least the anonymized sharing of data to do some of this integrated data systems. Comprehensive approaches to public system planning. Again, the federal government has a huge role to play, especially in cross-system data sharing. Only the feds really have the level of funding necessary to do the kind of rigorous evaluation that's necessary to move something from a promising idea to actually an evidence-based intervention. And finally, and obviously most importantly, I mentioned poverty, racism, and bad policy. Federal government, all government, has a huge role to play in smart policy choices that can reduce and hopefully end poverty. I'd love to see the feds and foundations jointly invest in an evidence-informed approach to preventing white racism. Wouldn't that be something? Let's think about the pathology of white racism. And finally, perhaps most importantly, do no harm. Thank you.